a good question.
All right, so
Okay.
thank you guys. I am here with Dr. Sisley, and we are having a very brief roundtable discussion. We have here a veteran and somebody who is a non-veteran but has PTSD symptoms. Dr. Sisley is an expert and a medical doctor, specifically in this issue of cannabis use for PTSD. And maybe perhaps we could start with you. Maybe you just go around, say what your name is, kind of a little bit of background about you, and then we can just kind of talk about some pervasive issues.
Sure. My name is Michael Vines. In the Marine Corps, I was known as Lance Corporal Vines. Served 4 years in the Marine Corps. Did one tour in Afghanistan in the Helmand province, and did another tour in Abu Ghraib in Iraq at the prison. I suffer from PTSD as well as TBI. TBI is known as a traumatic brain injury. Was suffered during a mortar attack in the Helmand province. I currently do not use any prescription medications. I've been off all my medications since 2012, and I regularly medicate with medical marijuana.
Okay. Tell me about that. How often do you use it? And what strains do you move toward?
I moved more towards indicas.
Okay.
For me, it's more of the only way I can explain it is that there's a lot going on, and I refer to them as noises, and it's just a lot of mumbled, fuzzy, it's static. And in order for me to not get inside of my head and try to figure out what it is, the indicas allow me to slow down.
Okay.
Whereas it's more like a Dilaudid
Okay.
would kind of care for the pain and settle your anxiety.
Yeah.
Because it's more than anything is my anxiety is very active, and my pain. I've took shrapnel to the hip and to my lower leg and my thigh. So I have a lot of like achy problems with my hips. So for the pain and for the anxiety, indicas are where I'm at. Sativas are more of the happy one. You know, if you suffer from depression or if you want to be functional, that's where you want to go. But for me, sativas, they get you real antsy. As anyone knows, it's one of the side effects of medical marijuana. Sativas is you get kind of antsy, maybe a little anxious. So I tend to stay towards the indicas, and I actually medicate as much as needed. For me, it's more of, for me to even be here today, I have to. I can't come out into public and feel safe without myself being calm.
So what's a typical day for you? Like, do you medicate right in the morning, or do you wait a while? How often do you dose it during the day? Do you use it before sleep and all that?
When I wake up, I kind of try to give myself, my brain an opportunity to adjust to, okay, I know where I'm at, I feel safe. I feel like medicating as soon as I wake up doesn't give myself an opportunity to adjust to my surroundings. So I give myself a time to adjust, and then I try to medicate right before I eat. And then towards the middle of the day, around 1, 2 o'clock, I try to medicate again. Roughly, I'll medicate at least 4 to 5 times a day.
Okay.
If it's a serious day. If it's an okay day, 3 times a day.
You smoke or vaporize?
I smoke.
Okay, that's good.
I also vaporize as well. For me, smoking it works quick, really quick. Vaporizing works okay, but smoking, it works instantly for me. I can feel an immediate change.
That's great to know. Thank you for sharing that.
You want a quick introduction?
Yeah, please.
Okay, my name's Evan Kidd. I'm a graduate of both Florida State University and Barry University School of Law. I just passed the Florida bar, and they probably won't like to hear this, but I medicate daily.
That's really courageous to say that. Are you? I want to. Have you been through the gauntlet of all the different meds? Did they try everything on you before you?
No, I wouldn't say everything. My situation was when I was diagnosed with PTSD. I was first put on Paxil. It was, I sort of ballooned up, and really a combination of events around that whole time had me in depression as well as PTSD. But I have an aunt who lives in Canada where there already is a medical marijuana system, so I was already exposed to the idea that marijuana could be an effective treatment in those types of circumstances. So when I wasn't really satisfied with Paxil, I turned to marijuana for treatment.
Okay, gotcha. That's really good to know. Do you, what about you, Mike, the treatments that you tried before, can you talk about that?
Oh, man. Well, first coming home, I was immediately, and when I mean immediately, like within a week, I was prescribed 100 milligrams of Zoloft daily. I mean, and anyone that's ever been privy to taking Zoloft knows that you feel like a zombie. You're not gonna function. You can't do anything. You can't think for yourself. You can't move very well. I felt sick to my stomach. I couldn't hold food. I mean, I didn't like it. I was also on Dilaudid 8s for the pain immediately also. They didn't start at 4s, they went right to the 8s. And it's weird, I didn't know how to dose the two because they're both kind of put you down. And the Dilaudid I would use at night more for the pain and to help me sleep. Later they prescribed me Ambien for the sleep, which intensified my night terrors and my nightmares. Vividly and just terrible. I've also, I've tried everything, acupuncture, hypnotherapy.
Oh, yeah, okay.
I've done alternative medications.
Sure, yeah.
I've done everything.
The cognitive behavioral therapy, you did all that.
I've also done my own therapy and what I thought might help me out, you know, and those things didn't help me out either. And then my wife just, you know, stood by me and continued to smoke herself because she also was a patient. And it was just there, you know. I went right back to marijuana. So.
Okay, I see. That's really good to know. Do you know other vets who use this plant?
Absolutely.
What do they say about it?
It's a miracle. I mean, it really is. And just the way that it's frowned upon in the military is the reason why. I heard you saying today that, you know, it's all of a sudden, everything is all of a sudden, and they don't want it to get out because they know that the medicinal value is way far more advanced than any pill that they have on the market, and the fact that it is, I believe personally, it's non-habit forming. It's not addictive. I'm not addicted to it, but I need to have it. I need to have it for myself and to be able to function. So I think that the reason why all of a sudden it's taken away from you is because they know how good it is, and they don't want it. They don't want it to get out.
That's really well said, yeah.
One point that Mike brought up that sort of triggered something for me was when he talked about his night situation, and I think that's really where medical marijuana has benefited me the most, in that, you know, PTSD, the big S is stress, and stress is something that builds upon itself. You know, you might start a day off feeling great, feeling like you're on top of the world, but, you know, something goes wrong during your day and it just puts you off, and it's really hard when you have PTSD to shake that feeling.
Sure.
You know, so when you're trying to go to sleep at night and you're supposed to rest and recharge yourself for the next day, you're instead thinking about whatever's gone wrong in the previous day. And that's a big thing that I found medical marijuana helping me with, was letting go of what had happened and relax and feel more connected to the world and ready to start the next day again, because I was able to rest.
Yeah. Do you find that you use different strains? Like, do you use an indica at night and a sativa in the day, or no?
Actually, yeah, that's a very apt description, because, you know, during the day, if I need to get something done, you know, maybe my chest gets tight. That's one of my big symptoms. My chest will get tight, and the sativa sort of relaxes me and puts me in a happier mood, whereas the indica will put me more to sleep.
Okay, that's good to know. Yeah, that's great.
Thank you, guys. I just have one last question, and we do have to wrap up our session.
Okay.
pertaining specifically to the Compassionate Care Act versus Amendment 2. I know this is something that's been brought up a lot in conservative circles in Florida as well. You know, on political rhetoric, they say that this the Compassionate Care Act is perfectly viable for all cases of use, and that Amendment 2 is just a pathway to legalization. I wanted to get first I wanted to get Dr. Sisley's perspective on that very quickly, and then each of you guys' perspectives on that.
Well, I think one of the things we talked about earlier was that the CBD-rich strains definitely have value, but they only really treat about 1 to 2% of the entire medical marijuana community that needs safe legal access to that medicine. So it's a really it's an important challenge for the state to figure out how they can treat the whole breadth of medical marijuana patients, and not just the small percentage of pediatric epilepsy cases and those few folks that can benefit from CBD only. What's interesting though about even those pediatric epilepsy cases are finding now that they need more options, that just using CBD only strains has petered out on them, and they're not really responding to those anymore, and they're going back into the black market in many cases and purchasing cannabis, whole plant marijuana on the street, using, looking at which hybrids are going to be the best. And so I think that's the message that I take from learning from patients, is that patients need an array of options. When it comes to marijuana, there's so many different strains, and strain science is only now starting to progress to a point where we're able to identify which strains might be best for which illnesses, but it's just at the very early stage. And so I think it's vitally important that Amendment 2 get passed so that patients can have access to all the different strains that they might need to manage. Just like these guys were saying, trying to find that best fit at the best time of day it's a real science to that, and we need to allow patients the access they need for those different options. So.
Yeah, I basically echo that sentiment and say that, not only do we want to help children with epilepsy, we want to cure cancer. We want to help people that have, for example, skin cancer here. It's a big thing in Florida. If you go online and, view the research they've done up in Canada, cannabis oil will cure skin cancer. Like, it's a fact. It's not suggested, it's been done. And these are the people that still need our help. So CBD is great, but it's not enough. We want to help everybody.
I guess I agree. I agree to those two statements, as well as I think this is what's right for Florida. I believe that 1030 is what it is. The CBD, hybrid CBD strain is great for the patients that need it. I'm not knocking it. I just think that this is what we need. This is what we need. We need choices. We need to be able to say, hey, this is what works for me. I've tried it already. This is what I need. So yeah, CBDs are here. That's great. Yes on 2, man. Let's get medical marijuana passed in Florida.
Thank you guys so much for being here. I am Neil Bigonaire with the Students for Sensible Drug Policy at University of Central Florida. I'm here with Dr. Sisley and our two our patients. And thank you so much. Thank you guys.
Thank you.
Yeah.
I thought the projector was the camera.
No, it's right there.
I don't think we got to that level yet.
Thanks, Mike.
Again, thank you so much.
Thank you guys.
For everything
Thanks
you're
a
doing.
lot. You guys are awesome. Good
Tell
job.
your guys I said what's up.
Very
So long.
good. You guys are terrific.
Tell them to keep their heads up out there.
Right, we will, man.
Keep working. Keep
Keep
working.
you updated. You guys
All right.
both stay on.
I'll get in contact with you on Facebook.
You better, man. You
All right,
better.
cool.